Free NGN NCLEX RN practice questions. Question 1. Set 1. What does alopecia mean? Loss of appetite, loss of hair, loss of hearing, loss of skin pigmentation. Alopecia is the medical term for hair loss. Question 2. Set 2. Which insulin is considered rapid-acting? Lispro, NPH, Glargine, regular. Lispro, Humalog, is a rapid-acting insulin with an onset of 15 minutes. Question 3. Set 3. A client is diagnosed with peripheral arterial disease, PAD. Which symptom should the nurse expect? Dependent rubor, painless ulcers, bilateral edema, warm skin. Dependent rubor, redness when legs are down, is a common sign of PAD. Question 4. Set 4. What is the significance of the TNM staging system? To determine the cause of cancer, to classify the extent and spread of the tumor, to measure the effectiveness of chemotherapy, to identify genetic markers. TNM stands for tumor size, node involvement, and metastasis. Question 5. Set 5. A mother is Rh negative and her baby is Rh positive. When should she receive RhoGAM? At 28 weeks and within 72 hours of delivery, only at delivery, only if she has a second child, at every prenatal visit. RhoGAM is given to prevent isoimmunization in Rh negative mothers. Question 6. Set 6. Which EKG change is most indicative of a myocardial infarction? PR interval of 0.16 seconds, ST segment elevation, T wave inversion, presence of AU wave. ST segment elevation indicates acute myocardial injury. Question 7. Set 7. What is the priority when a patient falls? Complete an incident report, notify the physician, assess the patient for injury, move the patient back to bed. Assessment of the patient's condition is always the first priority after a fall. Question 8. Set 8. A patient with type 1 diabetes is shaky and sweaty. What should the nurse do first? Administer insulin, check the blood glucose level, give 15 g of simple carbohydrates, notify the provider. Assessment of blood glucose is the first step when hypoglycemia is suspected. Question 9. Set 9. A child is admitted with tetralogy of Fallot. Which position helps during a TET spell? Supine, knee chest position, prone, side lying. Knee chest position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 10. Set 10. A patient with cirrhosis has an elevated ammonia level. Which medication should the nurse expect to administer? Lactulose, furosemide, spironolactone, propranolol. Lactulose promotes the excretion of ammonia through the stool. Question 11. Set 11. HbA1c levels reflect glucose control over what period? 24 hours, 1 week, 3 months, 1 year. HbA1c measures the percentage of glycated hemoglobin over the 120-day lifespan of red blood cells. Question 12. Set 12. Which sign is a hallmark of pyloric stenosis in infants? Green diarrhea, projectile vomiting, steatorrhea, abdominal distension. Projectile vomiting after feeding is the classic sign of pyloric stenosis. Question 13. Set 13. What is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hematmesis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 14. Set 14. What is the primary characteristic of anorexia nervosa? Binging and purging, distorted body image and self-starvation, excessive sleeping, fear of spiders. Anorexia involves a refusal to maintain a healthy weight and a distorted perception of one's body. Question 15. Set 15. Which lab value is elevated in acute pancreatitis? Serum amylase, BUN, hemoglobin, potassium. Serum amylase and lipase are significantly elevated in acute pancreatitis. Question 16. Set 16, what are the 3 P's of diabetes mellitus? Pain, pallor, pulselessness. Polyuria, polydipsia, polyphagia. Poverty, pollution, population. Pressure, paresthesia, paralysis. Excessive urination, thirst, and hunger are classic signs of hyperglycemia. Question 17. Set 17, which is a characteristic of croup? Productive cough, barking, seal-like cough, wheezing on expiration, high fever. Croup is characterized by a distinctive barking cough caused by laryngeal edema. Question 18. Set 18, which is a common side effect of radiation therapy to the head and neck? Diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 19. Set 19, a patient is taking warfarin. Which lab value should be monitored? APTT, point/INR, platelets, WBC. Point/INR is used to monitor warfarin, Coumadin, therapy. Question 20. Set 20, which breath sound is commonly heard in a patient with an acute asthma attack? Crackles, wheezing, rhonchi, pleural friction rub. Wheezing is caused by air passing through narrowed airways.